talking about that aging population, in 2030, it's expected that roughly 20% of the U.S. population will be people aged 65 and older. Right now, doctors are already handling 330,000 hip fractures a year. And there are many reasons the elderly break bones easily, but there are many things they can do to prevent those breaks.
The following segment is sponsored by Geisinger Holy Spirit.
People often consider the elderly to be more frail and delicate than the rest of the population. But the truth is, these days, the elderly are more active than ever.
We're seeing very complicated fractures in the elbows and the knees. We're seeing a lot of older athletes who are sustaining injuries that normally they wouldn't otherwise have just because they're doing those activities.
On top of that, Dr. Yelena Bogdan says the elderly generally have weaker bones and poorer vision, which leads to falls.
A lot of them have osteoporosis and osteopenia, so they have decreased bone densities.
Usually when these breaks happen, Dr. Bogdan says she tries to avoid surgery.
I'm very conservative. I treat a lot of things non-operatively with casting, and they do very well.
Typically, a cast will help a bone to heal in about 6 weeks. Surgery may be required, but it depends on the overall health of the patient and the location and complexity of the break. Either way, rehab is also usually recommended because mobility helps with healing, and mobility just as good for preventing fractures.
I think the most important thing is mobility and activity. So, don't sit in bed, kind of get out there and do as much as you can.
Other things you can do at any age to prevent fractures is to keep a healthy diet and weight, don't smoke, and keep up with appointments with your primary care doctor. And vitamin D and calcium supplements don't hurt either. With this week's Doc Talk, I'm Lyra Greenberg, CBS 21 News.